in this video, I am going to discuss electrical stimulation for edema management due to immobility. The goal of this treatment is to simulate a muscle pump and to use electrical stimulation to promote fluid flow from the periphery or the distal extremities back proximal towards the heart. This modality is appropriate and it's indicated for edema control if you're mindful of where the electrode placement is and you know that the edema is not caused from systemic origin or from organ failure such as heart failure. Some contraindications or precautions to be aware of with electrical stimulation include edema from systemic origin, cardiac pacemaker, uncontrolled arrhythmia, cardiac disease, impaired defibrillator, as well as impaired sensation and mentation. It's important to assess the skin before application of the electrodes as well as after you remove the electrodes. For the parameters for electrical stimulation for edema management due to immobility, so simulation of a muscle pump, you want a motor level stimulus with a 1-to-1 ratio of on to off time, so probably 1 second on, 1 second off. The negative electrode should be the active electrode, which is placed at the site of the inflammation. And then the positive electrode should be the dispersive electrode, which is placed more proximal to promote that fluid flow towards the heart. You should use HVPC current, a pulse duration between 150 and 300 microseconds, a frequency between 35 and 50 pulses per second. The amplitude again should be small, visible muscle contractions, and then you would treat between 20 and 30 minutes. Other considerations for this modality is patient positioning. So if your patient has edema in the lower extremities, you may consider elevation of those extremities as you apply the E-stim, because that would facilitate the fluid flow away from the distal parts. You could also utilize like Trendelenburg positioning, or you could utilize postural drainage to help get that fluid back towards the heart. For skin checks, like I said, you should monitor the skin before and after electrode placement to ensure that there were no adverse effects to treatment. And then other interventions that could be used for the same treatment goal would be compression. So you could utilize compression stockings, TED hose, SCDs, anything to encourage the edema to flow back towards the heart. This could also be used in conjunction with the electrical stimulation, so you could apply these things after your treatment. And then I already mentioned it, but if you're unable to do E-stim, you could use patient positioning alone just to attempt to bring that fluid back proximal. The important thing with this is to make sure that the extremities aren't in a dependent position, so gravity is not pulling down on the fluid and causing it to pool at the distal extremities in the limbs.